So my name is Tracey Stroup. This is my absolute favorite topic to teach. I love teaching this part. It's called face, tongue, nail. I use this in my practice, and as Jamie said, after 25 years of looking at sick people, they all have a very particular pattern that you can see on their face and on their tongue and on their nails. And when you see it 3 times over, it's a pretty good confirmation that you know what you're looking for. It's also a great way to ask better questions. So as with anything, this is for informational purposes only. It does not replace the care of your licensed medical practitioner. So make sure you seek any medical advice before starting any program. So a little bit about me. Jamie had said, I'm the Vice President of Marketing and Education at Nutritional Frontiers. I've been with them when I had my own practice, and I used their products. It was my #1 seller in my clinic. The efficacy was hands down the best that I've ever experienced with products. I love their synergistic formulations. The compliancy was very, very high for my clients. I'm a naturopathic doctor. I'm a certified natural health professional. I'm a level 2 digestive specialist with the Food Enzyme Institute. I've been in this about 25 years, and I'm a mom of 2 little boys. I'm a wife, and I'm a lover of Jesus. So that's where I start from. So why face, tongue, nail? Well, this dates back 3,000 years. I mean, this has been a practice that has been utilized for centuries. Historically, it was used to detect toxicity, emotional imbalances, deficiencies, things of that nature. Faults in your physical appearance will be indicative of certain problems that are inside your body. It's going to tell you a lot about what you need, who you are. But it also, I use face, tongue, and nail as part of a triangulation method. Whatever testing that you're utilizing, I always tell my clients, I'll run the test, but I really don't need it. You know, I can look at somebody, I know how to align with you. I know whether or not you like me right away. I can tell by your body language whether you're open and receptive to what I have to say. Hi. Jeff liked me. See, I just put his hands on his heart when he walked up, right? So it's also a great way for remote sessions, especially in a time such as this where your clients are fearful of coming in. They may not want to be exposed, right? So if you do any type of telemedicine, I always do something where I can see the client. So I can say to them, I want to see your face, send me a picture of your tongue, send me a picture of your nails. So this is a great way to get data when you don't have any data. Right? Face, tongue, and nail analysis cannot detect disease, but it can tell me if you're on a pathway of dis-ease of your body, because all disease comes from toxicity or deficiency. It's very simple. We overcomplicate it a lot. Some people have genetic mutations from years of toxicity and deficiency, right? So, and it also can determine alignment quickly with a client. Just by looking at someone, I can tell whether you're an auditory or a visual learner, whether I have to write the material down for you or I need to say it 3 times. I can tell whether you're understanding what I'm saying by the way you track your eyes to me or the size of your ears. So there's lots of things you're going to learn today. There's things that I'm going to go through a little bit quicker than others, but everything's in your packet. I tried to write out as much information as possible. I also brought the books that I use for resource. They're up here for anybody who wants to learn more, take pictures of them. Just don't take them with you. My name's in there. So you'll have to live with that guilt for the rest of your life. So this event is interactive, and I just want to go through a few guidelines so that we all are respectful of where we are in our walk with what's happening with COVID. Some of us, we're not afraid at all, right? I'm a faith over fear type of girl. I know I'm predestined here the number of days. I'm healthy. I do all things through Christ who strengthens me, and I don't worry about it. I move on with my life. But not everybody's in that same place. So I want you to be respectful because that's what this is really about today. It's about alignment. It's about knowing what that person needs versus what you want them to need, okay? So that's what we're going to learn a lot about today. So there is hand sanitizer on your table. You are welcome to work in pairs, but please stay with the same partner all day, okay? So when we do face, tongue, and nail today, when Jeff comes up to teach you MRT, muscle response testing, that's where you're going to confirm all your findings from this morning. So it's going to be really cool, back-to-back way to practice. And if you're at a party, this can be highly entertaining because all of a sudden people are like, read my face, you know, and I'm like, okay, $5. No, I'm just kidding. So I can walk out of a party with a couple $100 in my pocket, hands down. It's also a great way to establish clients because if you know something about them simply by looking at them and you can align with them very quickly, you form trust. And what you want people to do is know, like, and trust you. If they trust you, they believe in you, they will do what you say, they will take your recommendations at face value. Okay? So there are also mirrors available for anybody that wants to work on their own. If you're not comfortable partnering up, that's okay. We have gloves and masks available. You will have to remove the mask for the face analysis, but if you're doing it on yourself and you want to move away from the group, that's okay too. We have Clorox wipes available. There's hand wipes on the table. You will notice that there's supplements on your table. That's for the second half, where Jeff is literally going to have you muscle test different products with your partner. Okay, so this is very interactive, as comfortable as you want it to be. Okay, so if anyone needs a mirror now, please raise your hand. We're happy to provide you. I also have done this for corporations where I had CEOs take out their phone and take a selfie, right? And then I had them turn towards each other and stick their tongues out. It was fabulous. 68 CEOs like, ah, you know, it was great. So this is a great way to do large group analysis. And once you learn how to master this, this can be wonderful extension for corporate wellness in your company and a lot of other things that you want to grow and do, okay? So we do ask that you follow our COVID guidelines so that we do sanitize when we're touching each other, make sure that you're respectful of that other person and ask permission. Okay, everyone good with that? All right, moving on. Here's your supplies. Everyone get their packet out. I want to make sure you have everything. Number one, your face map. This is a face map. Okay, everybody should have this in their packet. Your tongue map. I mean, that's not hard to spot, right? That's a tongue map. Everyone should have this. Okay, we want to make sure we have a nail map, which is just a small picture of the nail. Mirror or a smartphone if you're going to do self-evaluation. I'm also going to teach you how to do this, guys, because if you need information from your clients and they're remote, you're going to ask them, can you send me a picture of your tongue? And you have to tell them how to do it because they don't know, okay? Aw, you're sweet. Thank you so much.
What did you say?
Thank you. You're sweet. You're awesome. You're the best. You're wonderful. So I'm just going to stand here and put up my vibe. All right, so data capture sheets. That's going to kill me, you know that, right? I'm not the most graceful person. It's time everybody knew. So your data capture sheets, there should be 2. Now this is for the AM session. You will receive a whole packet that Jeff has prepared for you in the afternoon. So you have one that has recommendations. This is for your physical assessment. And then you have the personality and emotions data capture sheet. That's going to be for your emotional assessment. Guys, you're going to learn a lot about people here today. We ask for confidentiality. We ask for respect. If somebody gets emotional, remove yourself from the room, okay? Because people will get emotional. You can call out things. I can look at somebody and know, just instantly, if someone's angry, grieving, and sometimes it just takes one word to trigger somebody. So if that happens, just know that's normal, okay? And you can walk out of the room and have a chat about it, all right? Pen or pencil, and you need a partner, okay? So everyone just pick a partner in your mind right now. Make sure they want to be your partner back. Keep an open mind today. Okay? It's going to be a lot of fun, but again, we're going to learn a lot about each other. All right, so we're going to teach you how to do a self-analysis real quick because you're going to need to know how to do this for your clients. So if you have a smartphone, how many people have a smartphone? How many still have a dumb phone? If you have a dumb phone, you have to use your mirror. But when you take a selfie, okay, when you're instructing your clients, you want the whole face, good lighting, no filters, and none of like the little duck faces and the 10 feet above, like this is 10 years younger, this is 10 years older, right? You want right in front, square. It is true. I know how to selfie. I'm like 45 feet up here. I'm like an embryo by the time I'm done. You also want them just plain face, no cheesy smiles, okay? Because you have to see, yes, remove any glasses, hats, things like that. Tell them to get their hair back out of their face because you want to see the forehead, okay? And if you're using a mirror to assess yourself, that's fine too. But again, you need good lighting, okay? So that's how you want to instruct people on their selfie. So when you're taking a tongue picture, you want to get back to the back of the throat. So you tell people, say, ah. And tell them to turn their flash on so that it gets a flash because you want to see those taste buds. That's how far back. Tell them tongue to chin because people will just be like, I'll be like, stick your tongue out. And they're like, I'm like, I can't see anything. So it has to be open mouth, very wide. Stick your tongue out as far as you can, keeping it flat. Now, everybody turn to your partner and stick your tongue out and say, ah. Does anybody notice their partner's tongue shaking? How many people saw a tongue shaking? Okay. So when someone sticks their tongue out like this, there's really no reason to do that. I just wanted to see if you do it. When someone sticks their tongue out like that and it shakes, what do you guys think that might mean? Adrenals. Okay? That's your number one indicator on the tongue for adrenals. So if someone comes in, they have gaunt eyes, their tongue's shaking when you tell them to stick it out, you have two indicators for adrenals. And we're going to learn all this as we go through. Okay, nail time. People like to go like this when they take their nail pictures. And they're like, look at my beautiful nails, right? Now, if you have fake nails on, right, like I do, which is a first, write this down. I'm not girly like that. I put nails on. It was a miracle. I was like, hey, they look pretty nice. These are coming right off after this event. But if they have fake nails, you won't be able to do the nail assessment. But my question is, why do you have fake nails? And most people say, well, my nails are so brittle or they break all the time. Write that information down. That's nutrient assimilation. That's low fat, low collagen, low protein. Okay? So you have to pay attention not only to what you see, but what you hear. Okay? So when you have them do a nail shot, you want them to turn their nails towards them like you're blowing your manicure dry, right? That way the blood flow is not constricted to the fingers. And when you go like this, guys, you'll notice your fingernails turn white. Well, if everybody took their shot like this for me, I'd be like, everybody in the world needs iron, right? You're all anemic. So we want this. We want the nails turned towards you, and then you want a thumb picture as well, okay? Some people will cross it over like that, kind of making like a little mouth face, right? But it's too hard to explain, so I just tell, take a picture of your fingers like this, turn it towards you like you're blowing dry a manicure, and then send me a separate thumb picture, okay? So it's hard to see on remote sessions the nails on Zoom because people are like, where's the camera? It's too far. Get pictures of the nail, get pictures of the tongue. The face is easier on a face-to-face. All right, so let's talk about the face. We're going to move into our face map, so you'll need this. Every part of the face means something to me. What I look for shape or proportion. You guys ever notice someone's face is lopsided? Okay, that's a big indication that there's a neurological issue. It could be that there's a nutrient deficiency. There could have been a head injury at some point. So it makes you ask better questions. Shape of the eyebrows are all about personality. Shape of the forehead tells me a lot about their younger years. When people have a big forehead, they had a good childhood. People that have really small foreheads, their childhood might have been rough or they might have experienced trauma. Okay, so shape and size matters. I'll let you guys analyze each other, I promise. Like I said, you're going to find out a lot about people. Okay? Wrinkles. People that have wrinkles, obviously that could be dehydration, but wrinkles in certain areas mean something to me. Okay? Wrinkles above the lip, you ever see people with lines? That's parasites. Okay? Spots, discoloration. We're going to go over this. I'm going to go through all this stuff with you. Acne, lips cracked, cold sores, blotching, dryness, capillary damage, especially on the nose. Does anybody ever done a face, tongue, nail course and know what the tip of the nose means? That's heart. People that have a big bulbous nose, they have a big heart. And guess what? They always give too much of themselves away. So guess what they need? Rest, boundaries, right? If I see someone coming with a big bulbous nose, I'm like, oh, here's somebody who has zero boundaries. Okay. And she'll sit down and she'll just be like, I just am so overwhelmed. I'm like, I know, you can't say no. She's like, how did you know that? I was like, well, I don't want to be like, well, your nose is big. I don't say that. Don't say that. All right. Corners of the mouth will tell deficiency. Okay, you might have somebody that has like lopsided, one down, one up, or a side of the mouth that's lower. People that have corners of the mouth that go down, they're pessimistic. You're going to have to prove it to them. People that have corners of the mouth that go up, they're optimists. They're always like, I'm into you. I'm hopeful. Let's do this. So that's alignment, right? You know if someone comes in, they're like, I'm not sure this is going to work. You might have to spend a little bit more time convincing them, nurturing them through the program, giving them more data, right? I had a girl one time I talked to, and she was like, well, how will you know when I'm better? I'm like, you'll feel better? I was like, right? So sometimes it's the most obvious thing, but they want proof. She was very logically minded. And then the thickness of the lips matter. People that have real thin lips, They keep their emotions tight. You're going to have to work for that information, and it's going to have to be a lot of trust. People that have full lips, they'll tell you a lot, and they're really passionate about what they say. They mean it. They say what they mean what they say. They may not say a lot, but what they say is right on point, and they never waste words. Okay? People that have thick, full lips, they love to talk. They love to communicate, right? So you have to listen more for them than talk to them. If they're telling you a story, stay silent, because you want to be a receiver, okay? So let's go through this map. At the top, the forehead is small intestine and bladder. People that have lines, broken lines, connected lines, those people are busy thinkers. They're also easily irritated, okay? If you don't know what they're thinking, they're like, why are you not in my head, right? Why didn't you know that? So small intestine is about assimilation of nutrients, also information, right? I'm assimilating everything I hear. Bladder is irritation. I'm irritated. So when people have a bladder infection, very first question I ask, are you irritated about something? They're like, well, yeah, my husband. Yeah, you know what he did? I'm like, no, I don't know what he did, but I'm sure you're going to tell me because your lips are very full and you're very passionate about what you're saying right now. Ah! I get ready. People walk in. I'm like, hang on, I got to stretch a minute. Okay, all right. All right, so bladder and small intestine up here in the forehead. Heart. You ever see somebody that has a line right above their eyebrow, right here? We call that an intuition line, okay? That line is really about feeling. If people come in and have real heavy wrinkle lines above their forehead, above their eyebrow, and if you guys want to see one, I have 2 of them. I'm all heart. Like, I'm going to talk to you about your emotions and, you know, your spirituality, and yeah, B12's good, but let's talk really, let's talk, right? So that's an intuition line. Those people know stuff. They know stuff about their own body, and you have to support that for them. You have to say, listen, you already know what's going on with your body. I'm just here to reassure you that, you know, we're going to do these things and you're going to get better. But you know. And they're like, yeah, I did. I kind of figured that. I knew something was wrong, right? They know. All right, right here in between the eyes. Okay, do you ever have your mom look at you like this? Right? I mean, as my mom looked at me. Yeah, there's a lot. They're called liver lines. What's the emotion connected to liver? Anger. Okay, so people that have 2 thick lines, obviously their liver needs support, so we could use things like Live Clear 2, magnesium, right? Things that the liver loves. We might use our new lean greens with our patented proprietary detox matrix, right? It's awesome. But if you ever see somebody that has 1 line, and remember, the body's divided into female and male. Left side, female, right side, male. If they have 1 line, it usually means there's some sort of alcoholism in their family. Okay? They themselves could be an alcoholic. You don't say that. Can't be like, drink much, Sally? I see it all over your face. Don't do that. It's bad. But you might just want to say, is there any addiction or alcoholism in your family? And most of the time they're like, yep, it's on my so-and-so side. And it's usually on the same side of the face as the gender of the person that suffered it. My husband has a massive line on the left side. And I knew right from the get-go there was alcoholism in his family. His mom died of alcoholic-induced cirrhosis of the liver. So, female side. Better question, guys. Better questions. Because people aren't going to just come in and be like, here's my entire life, right? But if you ask good, poignant questions, left is female, right is male. Now, some say, Jeff, that on the face it reverses, but I don't get into all that. I'm like, it is what it is, right? Okay, so in the middle, if they have 1 line here in the center, that's spleen. And what's spleen all about? Immune system, right? So what nutrient deficiencies could these people potentially have? Vitamin D, zinc, C, right? Heavy spleen line is usually indicative of a deficiency for the immune system. Or they have a stress going on that's repressing the immune system. Could it be food, chemicals, environmental toxins, heavy metals, candida, parasites? I don't know, but we're going to find out more, right? But these are just indicators.
Is that horizontal or?
It's a vertical line, straight up and down. So look around at people. You'll be able to see like, oh, you need some vitamin D. So when people come in and they're telling me about depression and neurological disorders and, you know, it's dark out and I hate this time of year and they have a heavy spleen line, I'm probably going to, you know, have their vitamin D levels tested. Probably not. I'll probably just give them vitamin D just because I know and I'm not wasting the time. I'm just like, take some D. Everybody needs it. So, all right, on the corner of the eyes, these are called crow's feet, right? Now, here's a little preface with this. I do ask my female clients if they get Botox injections. You need to know that, okay? Because they're going to get it filled here, here, and here. And usually you'll know because they have no expression whatsoever. They're just like, I'll make a joke, and they're like, ha, 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 ha. I'm like, do you get Botox? They're like, yeah, I do. But you do have to ask, because then you have to look at the tongue, okay? So that's why we do 3 areas, so that we can triangulate this. If I see it on the face, I see it on the tongue, I see it on the nails, I go, I know I have a win, okay? So these are adrenals. Now, we just learned, where else would you confirm adrenals? Sticking out your tongue, and it shakes. So if someone comes in with heavy crow's feet and their eyes are set back, you ever see somebody that just looks gaunt, like their eyes are way set back, they kind of have a hollowing there? That's adrenals, guys. If I see that, I'll say, can you stick your tongue out for me? And they'll be like, and I'm like, no, no, say ah. And then their tongue is shaking, I'll write down adrenals. I know it's adrenals, okay? Everybody good so far? All right, a horizontal line across the bridge of the nose is pancreas. That's going to be enzymatic activity, low production of enzymatic activity, because what does the pancreas do? Right? Insulin production and enzymatic activity. So when somebody has a horizontal line across their nose, which is why you want them to take their glasses off, because that'll be hidden, and not a glass imprint, I'm talking like right at the bridge where it starts to come out of your forehead. There's an anchor newsman on Fox News, and I don't remember his name, because, you know, do you remember who I'm talking about? It is so prominent. I just want to send him a letter and be like, Lord, if you're not on some sort of, you know, plan for diabetes, please do so now. So this is a good indicator of unstable blood sugar. And it makes you ask better questions, right? Are you having any issues with blood sugar? Most people will be like, oh yeah, I'm diabetic. Or, yes, I've been told I'm hypoglycemic, right? So the need there, and we're going to go through the physical needs when you guys start self-analyzing. The need there is either going to be enzymes or it's going to be some sort of sugar balance, right? Sugar sulf would be a good one. So how would you confirm that? What's Jeff going to teach us later? MRT. So this is how this all goes together. So if I have a suspicion and I see a heavy pancreas, I say, can you stand up a second? And I'll muscle test them for either enzymatic activity or low sugar insulin production. Or insulin absorption, right? Because a pancreatic issue can be low minerals, right? What minerals do you need to get the glucose into the cells, right? Chromium, vanadium. Okay, so under the eyes. Right here, you see where I have the word adrenal written? Okay, if you have real dark inside your eyes, real dark, not going all the way under, but right at the nose where the eye comes in and it's very dark, that's another sign for adrenals. There's lots of signs for adrenals. Why do you think that is?
Stress.
Yeah. I mean, who's not under stress, right? You're probably going to see the majority of your patients have adrenal signs and will need Adrenamax and Super B Complete. Those are your remedies, right? That's the bam-bam combination. So if that darkness is right at the corners and it's isolated, that's adrenals. But if it starts to drift under the eyes, if you have darkness under the eyes, you either have children like I do and haven't slept in 11 years, right? Or that's liver congestion, food intolerances. Now if it's puffy under the eyes, that's kidney. So you ever have people wake up in the morning or they come in and they have real puffiness under their eyes? That's kidney issues. You ask them, do you get reoccurring bladder infections, kidney infections, any problem with kidney stones? Most of the time as you ask questions pertaining to kidney health, they're going to reveal some things. The other thing that can happen is that they have low protein assimilation. So it's going to affect 2 pathways. One, liver, because it's going to cause congestion. And the kidneys are going to be overwhelmed because protein is very hard on the kidneys when it's not broken down properly. Okay, anybody ever see somebody with real red cheeks right here? Okay, that's low hydrochloric acid. That's stomach meridian. This is stomach. I see people getting acne here. I see people getting, dry skin, all that kind of stuff. I know that we have an issue with mechanical digestion of some sort. Most of the time an enzyme helps that, but especially one like betazyme that has the betaine hydrochloride, which is an acid provoker. We went over heart. Now people come in, you ever see people that have real heavy capillary breaking on their nose? Okay, that's heart. So Circucor, right, would be a great product to utilize for them. CoQ10 or PowerQ or PowerQ 600. Even just DMG, guys, to support oxygenation of the bloodstream and help with those capillaries. But if I see heavy capillary breaking here, a real strong red pattern on the cheeks, and a liver line, what am I looking for? One line, one heavy liver line. I'm looking for a heavy drinker. If I see people walk into my office like that, I'm kind of like, okay. It's a real touchy subject to approach that. They may be in recovery, but it's a really good way to be like triangulating 3 things that I look for. But if you do see heart, that's when you want to start asking, are you on any medications? Is there any history of cardiovascular disease in your family? Are you on a blood pressure medication? Are you on a cholesterol medication? This just gets you to ask more questions. Don't be like, oh my gosh, your heart. Don't do that. They don't like that. Yeah, most of the time they're like, what? What, am I going to die? No, you're good, you're fine. You can't recover from those. Okay? You ever see somebody with very indented cheeks, kind of like they look like they're doing the duck face for selfies, like, that's lung. Okay? Mm-hmm. And I have pictures I'll show you as we move through. We're going to go through some pictures. But they kind of look like caved in rather than sucked in. It's almost like a... the chiseled look? I'm sorry? The chiseled look? Not really chiseled. It's more of like, it's almost like a malnutrition type of look. Okay? It's an oxygen deprivation state. So their body kind of like, the skin gets real thin and it kind of falls into the skeletal structure. If you see it. But what if you see like rashes or acne on that area, right? Then I would start asking questions about breathing, like, are you have any respiratory disorders? Were you ever diagnosed with anything? Have you been exposed to molds or allergies? People that have allergies will have this structure because they're always struggling to breathe. People with sleep apnea, even if their face is puffy and pudgy, they'll have a dent right there on their cheeks. Above this top lip is stomach and small intestine. The bottom lip is large intestine. Okay, so when I see lines on the top lip, if they're not a smoker and not 97 years old, I'm probably going to suspect parasites. I may either scan for that, test for that, or muscle test for that. And Jeff's going to show you that later. People get cold sores, right? That's an underlying retrovirus that's coming up due to low immune function. It's a herpes virus. Most of the time, our body can hold that down. But if you don't have a good probiotic base, which is 80% of our immune system, which is where the majority of our probiotics lie, you're going to see things like that pop up. So guess what they're probably deficient in? Probiotics. They might also have a congested colon. And you want a good prebiotic like Frontier Cleanse to go in there and repopulate those prebiotics so that they have a beautiful garden that their probiotics can grow in. And then maybe back it with superbiotics. Okay, you ever see people that have real heavy lines here? That's called panda face. So it can go from nose to mouth or from mouth down to chin, almost like Frankenstein, right? That's colon health. Very first question I'll ask those people, do you have normal bowel movements? Most of the time they'll say yes, as long as I take Miralax and this, right? Remember guys, normal in the presence of pharmaceuticals or heavy aids is not normal function. It's forced function. So normal should be without help. And then on the chin, do you ever have women tell you, I feel like I've hit puberty again. My chin's breaking out. Okay, that's hormones. That's reproductive endocrine cycle. So when you see a woman come in and she's getting acne all above her chin and all across the bottom of her jaw, I'd start testing for hormones or asking questions. Are you in menopause? Do you have regular periods? How are you sleeping at night? You know, she's probably like, oh, I sleep fine until I get a power surge at like 4 o'clock in the morning and it wakes me up. So good thing here, ester cleanse, endocrine tincture. We have lots of good formulations. Okay, so everybody look at your partner again. I want you to look at their beautiful necks. Now don't stretch it up. Stop that. Stop stretching. Does anybody see lines on their partner's necks? Horizontal, going across like this. That's thyroid. Okay? So, if the lines are just horizontal and they run side by side, the farther apart they are, the more dysfunction. The horizontal lines going across your neck. The farther apart they are from each other horizontally, the more the dysfunction of the thyroid. Does that mean they have Hashimoto's or something like that? I don't know, I can't diagnose. What it doesn't mean is that they probably need some sort of thyroid and adrenal support, because why does the thyroid go, right? Mostly because of the adrenals. If it comes into like a triangle position where it kind of goes like 2 backwards V's pointing at each other, so the bottom of the V, and they go like this, that's usually some sort of conversion issue. Okay? You will notice every thyroid patient that you have has lines on their neck. The pattern just varies, and it varies along with autoimmune all the way through just simple iodine need. And as you get better at this and you start looking at people, you'll start to notice the patterns. Isn't this cool? See, all that money you spent on that testing? You didn't need it. No, I'm just kidding. Go ahead. I'll draw it. Oh, I have a board. Look how great my staff is. By the way, I think we should give our staff a huge round of applause for getting this all set up. Kim and Brady, and you guys were here last night, and the whole team, you're wonderful. I hope this erases. All right, listen, I am not an art major. Okay. Okay, so this is your neck, right? You have lines like this that go across. Some are deep, some are faint. The space between is really determining the need in this dysfunction. The farther away they are from each other, the more the need, the more the dysfunction. You can have all kinds of patterns, but when I start seeing patterns like this, I'm going to start asking questions about, have you had blood work on your thyroid? You know, have you had your T3, T4 tested? Any antibody tests? That's what I'm going to want to see. So I can't diagnose, right? But I can ask better questions, and I can get better results from people that can take those tests that I need to confirm my suspicions so that I know what to do for them. And it doesn't hurt to collaborate with medical professionals, right? That's what we're here to do. We're learned to integrate. Because sometimes people can do things that I can't, like chiropractors. I can't adjust people, but I absolutely know that thyroid function can be directly related to a cervical issue, right? So I might send them off to Dr. Orbach or Dr. Honigman at the Weiner Wellness Center and say, go get an adjustment. I think that's something. I think you have a structural issue as well as a physical need. Okay? Any questions on the face? Crash course, right? So now it's your turn. You're going to partner up. I want you to look for the biggest screaming things. You're going to see lots of things, but the biggest 3. Those are your first 3 that you're going to talk about, okay? And then once you have that data, I'm going to give you about 5 minutes to analyze. We're going to walk through the pictures, and I'm going to give you all these solutions. You have a solutions page on the next page. You guys see that in your PowerPoint? Those are all your NF solutions to every one of these places. So use this map on your recommendation sheet for your person, because here's what you're going to do. You can keep this for yourself, or you can exchange it, or take a picture of it with your phone, right, so that you have that information. But right here, you're going to write down your face findings, the product, and the recommendation. So if you see heavy liver lines, what would you do for that? Live Clear 2, lean greens, magnesium, later on, you're going to take this paper and you're going to be able to muscle test for your confirmation, and then you're going to have a walkout protocol for the person in front of you. Cool, huh? All right, 5 minutes. Pick your partner. If you're working, if you need a partner, raise your hand. Okay, good. Remember, you may not know all the solutions yet. Just write down what you see and what's the screaming child that you see. You can come back when we go through the solutions for everything. I had a good point. If everyone can listen up for 1 second. Sorry to interrupt your analysis. I'll give you more time. I missed one point that I was just, someone asked me about. The ends of the eyebrows, right here. If they're missing, what does that indicate? There you go. You guys already knew it, so there you go. Thyroid. I know we want to keep analyzing, and I'm going to let you continue to do that. Attention, everybody. Hey! So, I know this is a lot of fun, and I want you guys to keep interacting. You can do this through lunch, and I would encourage you to keep assessing each other. I want you to have the eyes to see, right? So 2 things I want to point out. Does anybody see eyelids drooping over, like the top of your eyes drooping over your eyelids? Does anybody have skin that falls down? Okay, that's protein assimilation. You're also not just looking for wrinkles, but you could be looking for acne patterns, spots. You know, that can be liver need when we see brown spots, okay? When you see adrenals, it doesn't necessarily mean their adrenals are tanking. It might just mean their lifestyle is not supporting their adrenal health. It's just better questions. So I want to start like a dating service of like face, tongue, and nail, because I think it would eliminate so many problems. Does anybody smile and have a horizontal line across their top lip? Right? See mine? Okay. That's determination. I am determined. Yeah. So I'm a determined person. That's another thing. If somebody smiles at you and they have a heavy line, like that's like, oh, she's determined. Okay? This little vertical line here on your top lip, okay? Now I'm going to tell you a secret, ladies. It tells you about how good of a lover a person is. This is part of my Match.com face tongue now.
You're too young to do that.
I'm gonna shut her young ears. Okay, so it tells you how good of a lover a person is. If they have a very deep line, that means they're probably a good performer. I'll just say that. Okay? You're welcome to all the single ladies, and everybody that's married, you can go home and take a look. If your husband has a beard, you might want to ask him why. No, I'm just kidding. All right, let's move on. Any questions on the face?
What's the line across?
That's determination. A horizontal line, like when I smile, oh, I know, I'm determined. Yes. Oh, very good point. Thank you for that. Somebody asked a question, what does the line down here on your chin mean that goes like an upside down horseshoe? That is also an indicator of hormones. Men, if you have a dimple here, okay, dimple on the chin for men, check prostate health. Ask questions about prostate. Ask health history about prostate. Nurture the prostate, okay? So, upside down horseshoe, that's hormones on men and women. Dimple is prostate on men. See, you didn't know you were going to learn all this, did you? All right, tongue reading. Yes? Yeah, the vertical lines and the horizontal lines. So somebody asked something about the ears. Now, what I said earlier to somebody, I could teach a whole day on just physical features of the face. 4 hours, hands down, easy. I'm giving you guys a crash course, okay? There's so much to this. I'm going to go over the emotional too. However, when you have ears, right? This guy's a good listener. What kind of learner is he? Auditory. Good job. And we have lines like this that go on the ear, or one line like this. That's an indicator of heart issues. Okay? Ask more questions. If the lines are in front of the ear like this, that's sugar issues. Yes? If there's lines on the ears, either vertically like this, one line, two lines, or horizontally like this on the lobe, harder to see on women with earrings, right? But men, you can see it. That's heart issues. You want to ask better questions about cardiovascular health and history. If the lines are in front of the ears, like right here, guys, okay? And you have like these little lines like this, that's sugar issues. Okay? Keep asking questions because I'll teach it. I just can't think of everything all the time. Okay, the tongue. This is a powerful tool because the tongue is made of epithelial tissue. It'll change in 3 days. So if you want to show somebody if something's working, let's say they come in, they have really heavy candida. How would you see that on the tongue? White coating. Not a white color, but a coating, right? Now, some coating is okay. It is okay. Everyone's like, oh my gosh, they have coating. I mean, a slight coating is all right. We should have some candida in our body. It's a good guy. It's a blood barrier protector. Too much is a problem. But this will change in 3 days. So when people say, well, how will I know if it's working? I'm like, check your tongue out in a couple of days. You'll be able to see improvement. Okay? So if you don't want to stick your tongue out over and over again to your partner, have your partner take a picture of it. Then guys, post it to Facebook later. No, I'm just don't do that. Take a picture of your person's tongue. That way you can blow it up and you can look at it. You know, usually I'll say, stick your tongue out. I'll take a picture of their tongue, and then I'll work off my phone and blow it up. Because it's really awkward when you're not proficient at this for someone to be like, you know, for like 10 minutes. Their jaw gets tired. It's just awkward for everybody. So take a picture of it today. I think that'll help you guys. But this is an integral part of a practitioner to determine organs and systems that need to be cleansed. You know, the breath, your teeth health, your gum health, your mouth health, your tongue health. If the tongue's swollen, if it's real red and hot, if it's purple, it tells you so many things about someone's. That's why when you used to go to the doctor, they would tell you to stick your tongue out. They were looking for things. They would look at your nails. They would look at your face. They would actually take more than 12 seconds with you, right? Today, it's like, hurry up, we got to pump them out through the door. So, nutrient needs, everything that we did on the face, we're going to see on the tongue, okay? So here's what I look for. Heavy center line down the center of the tongue, okay? How long is it? Is it going front to back? We're going to go over some pictures of this. Coating of any kind. Yellow, green, black. I one time had a client come in. She stuck her tongue out, and along the sides of her tongue were black dots. And I said, how long have those been there? And she said, just for a couple months. I said, have you had any recent blood work? Because I knew what I suspected, but I didn't want to scare her. So I told her that she needed to go for blood work. Now, on your tongue map, you can see that the liver and gallbladder is on the sides of the tongue. Black spots. What do you think happened? What do you think I suspected without being able to diagnose, and I had a licensed medical professional confirm my suspicions? Liver cancer. Yeah, she had it. But that was the first sign. Now, maybe nobody would have caught that. She wasn't symptomatic. She came to lose weight. She started gaining weight. That was her sign. And I saw that on her tongue, and I sent her out. And, you know, she went and got treatment. She took a medical route. We supported her with nutraceuticals, and she was fine. So it was caught early enough. But she had one little small, I think it was like a little tiny tumor in there. But they removed it, did the normal pattern of chemo and radiation, and she was okay. So sometimes you see things a lot earlier because your body's going to speak. It tells you what's wrong. Okay? Red dots, geographical tongue. Anybody ever see someone's tongue? It looks like a map, right? It's like blotchy and red, and then it has, that's geographical tongue. Underlying color of the tongue, whether it's pink, red, purple. I ask about mouth ulcers, any type of gum disease. That's going to tell me probiotic health, K2 health, vitamin C need, B12 need. Okay, and does this tongue shake when we stick it out? So this is your tongue map. But if you think about the face, where were the small intestines and the bladder? On the forehead, right? Our spleen line was here. Our stomach was here. So the tongue map is going to follow somewhat the face map. This is lung, okay? And then heart. If you see somebody have a really red, hot tip to their tongue, I would start asking more about cardiovascular. But where would I look on the face as a second indicator? Your nose. So you see how you start to triangulate just by looking at somebody. Okay, so these are some examples of geographical tongue. Let's walk through some of this, right? This can be dysbiosis, candida. Your solution for that would be CandiKill, SBC, GI Complete. Red hot tongue, right? Like this. That's a lot of heat. That's a lot of fire. I'd probably do a B12 so that it supports the liver. Purple tongue, that's stagnation. Look at that. I'd probably do something like Circucor, maybe even DMG by itself to increase oxygenation. I'd probably be looking for liver indicators on the face, heart indicators on the face. Okay. Yellow tongue. I mean, if it's a coating with yellow like this, obviously ask them if they had any coffee if it's a morning client, okay? Because they'll come in after stopping at Starbucks and you're like, oh my God, and they're like, no, it's a latte. And it's like, oh, I have latte disease. Oh, thank God. Yeah. And kids too, when parents bring kids in, they're sucking on lollipops and then their tongue's like all different colors. So make sure you ask questions too. All right, so do you see these heavy cracked lines? Now this is the center. Now we know, according to your tongue map, the middle of the tongue is stomach or spleen. So how do I determine which one this means? Where would I look on the face to figure out if what I'm looking at is a stomach issue or a spleen issue? Where's stomach on the face? Cheeks. Where's spleen? Vertical line. So when I look at someone's tongue and I see a heavy vertical line between their eyes and their tongue kind of looks like this, I'd be like, oh, that's low immune function. But if I see something like this with these little offshoots, I'm going to guarantee you 9 out of 10 times this will be low hydrochloric acid. When I see it branching off like this and cracking, it's usually low hydrochloric acid. But look at this person's tongue. I mean, just overall dehydration. We know that hydration works directly for producing hydrochloric acid in the stomach. You have to be able to pull a hydrogen from the blood. The only way you're going to get hydrogen in the blood is with H2O. You have to be hydrated. That's why your blood is plasma. Okay? People that are dehydrated, that can't hold water, usually have low hydrochloric acid too. And then the mucosal lining starts to get compromised. Look at the color of this tongue. Do you notice how it's kind of white, but it's not a coating, right? That's usually a sign to me that they have low iron. Could be anemia. Okay, here's another point to check for your face map. If you pull down the bottom lid like this, okay, and you look at the color of that lower lid, that'll tell you if they need iron. If it's pinkish red, their iron levels are good. If it's white, they may have an iron need. And then you could confirm it by looking at the color of their tongue or their nails that might be real white. You can also tell what sex of a baby is in your eye, too. We should have a contest. All right, so you see this looks like overall dehydration on this tongue. Do you see how this tip is all bubbly? So we got low hydrochloric acid. We know that there's a low protein assimilation. Dehydration, looks like some anemia. And now the lung and the heart are affected. Why? Start thinking. What would low iron cause? Low oxygen. Yeah. So I look at this whole tongue and I'm like, drink some water, let's take some enzymes, and we're going to get you on some iron and B12, and I'll see you in 3 weeks. I want to see how they do, right? Don't overthink things. Okay, this guy, see how far back this goes? All the way down to the tip. So when we look at this gentleman, it's either stomach or spleen. I would have to confirm that on his face. It could be, anything from low vitamin D, vitamin C, or it could be something that affected his stomach, has now affected his lungs, and is affecting his heart. So I would probably do Cybezyme for the digestion, and acetylcysteine for the lung support, and Circucor for the heart support. And we're going to learn about this guy emotionally, but it's probably something in his life that he couldn't stomach that caused him a lot of grief and broke his heart. So I'd probably ask him, you have any trauma lately? Right? And you can get all that from a tongue. Michaela, how about it? We did this together, didn't we? We're awesome. All right, what about this tongue? What do you see? Do you see how there's little dots on there as well? Okay, there's little red dots. So it's very white, and there's red dots. So this would probably definitely, to me, be low iron and B12 deficiency. Red dots on the tongue can either be B12 deficiency, or if it's a woman, it can be hormone imbalance. Now, where would I confirm hormone imbalance if I suspected that? On the face, on the chin. I'd look for the upside down horseshoe. I'd look for acne. I'd look for hairs. You ever notice women are just like, I got this weird hair growing out of my chin, right? No? No one knows that? I'm asking for a friend. No, I'm just kidding. So here's your solution. Easy iron, methyl B12. Okay, we're covering lots of different things. I'm also looking at her neck a little bit. Can't really see it, very faint, maybe a couple of lines there. Now this is a child. Do you see the difference? How in a kid, it looks almost like a strawberry. That strawberry pattern is usually B12 deficiency in kids. But how many kids really eat all their protein and meat, right? They're usually carboholics. They like spaghetti. Don't give me a meatball, and I just want butter on it, no sauce. Right? I have kids. I'm like, you're going to eat the meatball. So it can have two different indications. You have to pinpoint it with another map area. Okay, time to partner up. Mark down any lines, cracks, the color of the tongue. Oh, one thing I do want to point out. If anybody has teeth marks on the side of their tongue, what could that indicate? Liver, gallbladder congestion. But when you're getting teeth marks on the side of your tongue is swollen. Okay, so that can be food sensitivities. And a swollen tongue is also an indication of spleen. So if I see teeth marks on the sides and the tongue is swollen, a little bigger than what you think it should be, where am I going to look on the face? Spleen, right? Okay, go ahead, Mike.
Repeat again what an upside down horseshoe is again in the intuition line.
Yeah, the upside down horseshoe on your chin is an indication of hormone imbalance. And then the lines above your eyebrows, those are intuition lines. Like I have one right here if you guys want to see it. You just look at my wrinkles and face. Like, just come explore. So that's an intuition line. It means you lead with your heart. You go with your gut. You don't go, it's like you just know. Like you're just like, I just know. All right, guys, 5 minutes, pair up, take a picture, turn your flash on. Not of yourself, Jeff. He's like, selfie. I'm just kidding. Okay. Okay. See, self-assessments work. If anybody needs a mirror, if you're doing a self-assessment, we have several mirrors we brought.
Has a line that doesn't end.
Right.
What does that?
Let me see. Yeah, well, she gives her heart away, for goodness sakes.
But what is it when you have a large line, you give your heart away?
Well, it's running into her lung. We already know it's adrenals. No, you're fine. Mm-mm. So, do you have any redness here ever? Okay. Yeah, so what I would probably say is it's probably either... Yeah, I just do heart support, and maybe she's not digesting her protein enough, so she's not getting enough of the protein to rebuild heart function. Maybe some CoQ10, but she does. She grieves with all her clients. You're going to see lots of things on people's tongues. I will tell you, use your intuition, use your skills. It's not always, exactly the pattern that I explained. Sometimes there's things that you'll see and you'll be like, what's that? It doesn't look exactly like she showed me the picture. Some people would have a tongue pattern. It's not always like right in the middle. They could have like some cracks right outside of that center. So go ahead. You had a question? Question? Okay, we're going to move into nails. I know this is so exciting, isn't it? I know. I love it. So it's a lot of fun, and I'm going to give you guys some time to work together. Okay, so with nail reading, this is a great way to learn about habits of your clients. Go ahead, Mike. So most likely, those are 2 liver lines and 1 spleen. So the area between the eyes is liver and spleen, so depending on where it is. Now, if they're all in the same place and they're right smack in the spleen, then that person is an obsessive thinker. They obsess over stuff. And they're probably obsessing over that question right now. So I'm going to tell you, you're fine. I promise, take some vitamin D. It's okay. Calm day. It's good. I'm just kidding. But it all depends on where they are, if they're spaced out. Your liver lines aren't going to be exact. They don't have to go out to the side. You can have vertical liver lines. People have liver lines. It's not going to be picture perfect, guys. Go ahead, Mike. Yeah, Immunomax is great for the spleen. Vitamin D3, our Sunshine D, would be great. Vitamin C, zinc, super zinc. This just gets you to ask better questions of what you're looking for. If you see spleen all over somebody, I'm going to say, what's your SOS? What's your source of stress? Is it food? Is it environment? Is it emotional? Right? What deficiency did it cause in your body, and how can I find that out? Do I need to do blood work? Do I need to do a scan? Do I need to muscle test for confirmation? And then how much do I need to fill the gap? Those are the questions. When you see things on the face, it's not like, it's over. We're just going to ask better questions. So what you're going to learn now is as you walk through your map of recommendations, when we learn nails here, you're going to see that certain things show up on the face, they show up on your tongue, and they show up on your nails. And when you have the complete puzzle, you'll be able to be like liver, 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 heart, 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 digestion, digestion, digestion. Okay, we got to support your digestion, your circulation, and your liver detoxification. So today we're going to go with GI Complete, CircuCore, and Live Clear 2, and I'll see you in a couple weeks. Boom, boom, boom. Okay? Don't overcomplicate it. We're going to look for 3s. We're going to triangulate this in a minute. Okay? Right now you only have like 3/4 of what you need. Go ahead.
So if you're taking this stuff and it should be correctly, will all those things clear up then?
Yes, it can. However, we're going to get into the emotional side of this in the second hour. And if you are constantly in the state of whatever that emotional SOS is and you keep believing it, you can't outrun your emotional mind, right? The subconscious is more powerful than B12. I'll tell you that.